Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, and we're at the Columbus Cancer Care here today. So, Doctor, how are you doing?
Fine, thank you.
Well, tell me a little bit about what it is you guys do here.
Okay, well, Columbus Cancer Care, we're a radiation therapy center, so we treat just about any adult cancer with radiation therapy.
Okay, very cool. And this is something that is relatively new, you would say, to Columbus. It was in the 2010 or so when you guys kind of announced this was going to be a thing here. So what's kind of the development and the transformation of the center been like here?
Well, we opened the center in 2011.
Okay.
And we've been seeing progressively more patients. We've seen about 600 patients since we opened. And we treat all the common adult cancers. We treat some benign diseases. And the community's been very warm and welcoming. And medical staff here has been great.
Why did you decide to bring something like this to the Columbus area?
Well, I used to work in Omaha at Emmanuel Medical Center. And when I was in Omaha, I would see quite a few patients from the Columbus area that would be coming all the way to Omaha for 5 minutes of radiation treatment. And radiation is the kind of treatment that's usually several weeks, Monday through Friday. And it was a great strain on patients and their families, and I got to see that firsthand. And so I started thinking about what it would be like to bring radiation therapy here to Columbus, and it sort of evolved from there.
Very cool. Well, not only do you have that physical treatment, but also, I should say, some mental treatment as well, because you have some support groups, right?
We try to treat the whole patient and take care of the family as well, because having a cancer diagnosis really involves the whole family or caregiver group. So we do have a support group that meets once a month every Tuesday here at the Cancer Center. It's free, everyone is welcome.
Okay. Well, how did you get into this field or this type of treatment? What was the path educationally and what made you decide to do this?
Well, I went to medical school not knowing for sure what I was going to do, but I do have a family history of cancer. I've lost most of the people, especially on my mom's side, to cancer, so I had a special interest. And then during my medical school, I had to do some rotations through radiation oncology. So I did a year of internal medicine in New York. I'm from New York originally, so I did a year of medicine at Staten Island University, and then I did 3 years of residency at Hahnemann University in Philadelphia. Did an American Cancer Society Clinical Oncology Fellowship, and here I am.
Well, and talking about being here, so you've been here steadily since 2011, where you're just, you're really here, and talking about being in the Columbus area since then. A lot has happened here. What are the changes medically that you've seen here? Does it seem like you guys are more readily able to treat patients as the years go on and the facilities continue to grow?
I think so. We have a really wonderful medical staff. We have great surgeons. We have good medical oncology, good radiology. We've developed with the hospital a great support system for hospitals. Columbus Community Hospital has a great survivorship program with occupational therapy, physical therapy, speech and swallowing therapy. We have good social work. So we try to deal with all the psychosocial as well as physical issues in cancer care. And at this time, most cancer problems can be treated here in Columbus without having to go to a bigger city.
And I mean, is that something you think most people probably didn't think that was going to be a reality, I'm sure, years ago, so that's pretty exciting.
Well, that's been my goal, and I'm working steadily towards that. We got this machine here, which is a tomotherapy machine. The machine itself is a $3 million piece of equipment, and it is really state-of-the-art as far as treating people with the most technologically advanced radiation therapy to target tumors and also to try to decrease side effects.
Wow. So are there other programs or anything else that you guys are doing to help cancer patients and their families?
Well, there's one thing I'm particularly excited and passionate about. About 2 years ago, I and a group of people in the community started the Columbus Cancer Care Foundation, which is completely staffed by volunteers, and it was designed to support the needs of cancer patients and their families through their cancer journey. So we do things like support them for transportation. We have a dedicated patient transportation van that will take people to and from treatment, not just for radiation, but for chemo or surgery or hospitalizations. We even take people to Omaha if they need specialized services like pediatric oncology that we don't have here. It does fund the support group. We have gas cards, we have a wig bank, and we can make custom wigs. Women can come in and get measured and have their own style and color of hair, and we'll make those wigs for them for free through generous donations from the community. So we have a lot of programs in that nature, which I think are really important.
And part of that, the Blue Jean benefit, is something that you guys have been doing annually now. How important is that to that foundation to have that?
That is our main fundraiser for the year. We do accept donations all year long for the foundation, but the Blue Jean benefit is our main fundraiser. We do it to raise awareness, and it's been a lot of fun. We're going to have our 3rd annual this year in September.
Very cool. Dr. Keit, thank you so much.
Well, thank you.
All right, and thank you guys for joining us as well here on News Channel Nebraska. This has been another edition of Meet the Docs, sponsored by the Columbus Community Hospital. We'll see you next time.